So I'm really excited to tell you about anterior hip replacement. This has been one of the most disruptive, in a good way, things to come in orthopedic surgery. For years we've done hip replacements going through an incision in the buttock region, and now we're doing it where we go through the front of the hip. The beauty of this is we don't have to cut any muscles, we don't have to detach any muscles from the hip, so that gives a lot of added benefit. First benefit is that it hurts less. Patients love the fact that, especially people who have had a hip on one side done from the back approach and one on the other side from the front, they'll say it hurts less, the recovery's quicker. The second is we're seeing a less risk of dislocation. So let me show you how a hip replacement works. There's two major portions of the hip replacement. A portion which goes down into the thigh bone, we call that a stem. And that is usually coated in a very porous titanium coating that bone loves to grow into and become part of you. A ceramic ball is then attached to that stem. And then we have the same titanium porous that goes into the pelvis. And again, bone loves to grow into that, so that becomes part of you. And then we have a surface which goes inside that's very smooth, and that allows for a smooth bearing surface which causes less pain and increases mobility of the hip. When we don't cut muscles or detach muscles, we decrease the risk of that happening, the artificial ball popping out of the socket. So I sleep way better at night knowing my patient's hips are going to stay in place. The second advantage is we don't have to distort the hip very much. We can do these through very small incisions because we don't have a lot of territory to go through. So people are always surprised at how small their incision is, which is typically 3 to 4 inches. The third advantage is we're using devices in the operating room, live x-ray machines, which we weren't able to use before through other approaches, that allow us to make sure we're putting this in perfect orientation for that patient, and also restoring their limb lengths or their leg lengths to where we think they need to be. We're using a device called OrthoGrid, which also helps us align the implants and align the legs perfectly for the patient. So this approach hurts less risk of dislocation, smaller incision, quicker recovery. I can get things more perfect, so it's just a much more sophisticated way of doing it. So I've been extremely pleased. I've been doing this approach for 8 years now and extremely pleased with it.